So it is important that we give some sort of bronchodilator therapy which will open up the airway. But the mainstay of treatment for asthma patients, if there is a clear-cut symptom, if they are not mild, is inhaled corticosteroids. We provide some sort of inhaler which has an inhaled corticosteroids in them. And the modern management or care of asthma is that if your symptoms are worse, then we up the treatment. We go stepwise in a ladder pattern. So if the symptoms are bad, we go up the ladder. If the symptoms are well controlled, we can come down the ladder. And there's a myth that people think that if they're given inhalers, it's like you're always on that and it's addictive. It's not like that. So asthma management therefore needs a lot of monitoring, and this is important that we give the inhalers, which could be upgraded when the symptoms are bad, and when the symptoms are better, then can be downgraded. Now, how do you know when symptoms are bad? Especially, the question about how they're doing at nighttime, because the people who are getting nighttime symptoms are a bit of a worry and would need more help from us. And especially this is a diurnal variation of the disease, so it causes narrowing of the airways, which is worse in the mornings as well. So when we ask them to maintain a peak flow meter chart, which we haven't covered on investigation, it's a very important test we do for our patients. We ask them to use something like a hollow tube like this, which is called a peak flow meter. And what we do is we do blow into this meter. I'll show you how it's done. And it gives you certain readings, which is shown on the dial here. And that reading has to be noted down in a diary card and has to be done first thing in the morning, last thing at night. First thing in the morning, last thing at night. So it be monitored and written down on a diary card. So I'll show you how it's done. So you blow as hard as you can, and just sitting, you can do this test. It's called peak flow meter test, and you can do peak flow meter charting twice a day. So you blow as hard as you can, as long as you can in this machine through a hollow tube, and it shows you certain readings. I'm sure you can see it through the camera that this is what we are getting, the reading, and you just ask your patient to jot it down. Ideally, they should do 2 and take the best out of the 2 readings and jot it down on the diary card. It should be done first thing in the morning and last thing at night. It's a very important tool, the peak flow meter charting. And when we review that in the clinic, along with our exhaled nitric oxide, then we are able to assess how much the airways size is changing and how the inhalers are impacting.